Hello guys, good afternoon. This is Miss Henderson. I hope you're having an amazing day. Thank you again for tuning in to my YouTube channel. For my existing subscriber, thank you so much for being a part of this family. And I just make these videos to help nursing assistant students to pass their Prometric exam or their CNA exam. Again, if you like these types of content and these types of material, please subscribe to my channel and please give this video a thumbs up, and please drop your comments below. Let me know what other videos would you like me to provide you with. That being said, let's dive into the video. The first question we have here, question number 1. We have the mix with gastric juice to form a semi-liquid substance is called A. Chyme, B. Peristalsis, C. Bile, D. Feces. So we talked about this in the classroom, and we stated that that your food is mixed with gastric juice to form a semi-substance called chyme. So chyme would be the correct answer for this. Cannot be peristalsis. Peristalsis is like a wave-like motion that pushes food down the GI system. So the correct answer for this question is A, as in alpha. Let's look at question number 2, guys. Direct questions are used by a CNA. Now, we talked about this in the classroom. We talked about direct, open-ended, and close-ended question. So direct questions are used by a CNA. A, show the patient that you care. B, make sure you understand what was said. C, focus on specific information. Allow the person time to think. So think about this. Direct questions are used by a CNA. The correct answer for this question will be C. Focus on specific information. So when you want to zero in on specific information, you have to use direct questions. So that's C is the correct answer. Question number 3. Everyone likes to be touched by a CNA? No. We talked about this also in class, and we stated that not everybody likes to be touched. It depends, on their culture and the ethnicity. Not everyone likes to be touched, so please do not go around as a CNA touching all your patients, because not everybody likes to be touched. It depends on their culture and their upbringing. Question number 4. This should be an easy one. Giving your opinion as a NA. NA stands for nursing assistant. Promotes good communication? No. We talked about this one also in the classroom, and we stated that we cannot give our opinions to any patients. We are not supposed to be doing that. Give our opinions. So this is false. Question number 5. This is another easy question that you should be able to get correct. The CNA must assume that a patient who is comatose can hear and understand you. We talked about this in the classroom, and we elaborated, and we stated that yes, that oftentimes when a patient is comatose or a patient is on a ventilator and they can't speak, and you think that they're like brain dead, but they could hear you. The last senses to go, guys, is the hearing. So even though they're not responding, when you're doing care, you're supposed to like explain everything you're doing, because the last senses to go is their hearing. So they can definitely hear us when we're doing care. So make sure when you're caring for a patient that is comatose or on a ventilator, you still have to explain to the patient exactly what you're doing. So this is correct that they can hear. Question number 6. Listen and use silence when dealing with an angry person. This is absolutely true. We talked about this in the classroom, and we said a lot of times, as a CNA, you may have to deal with patients that are very combative and very angry, and we have to basically we have to like listen and use silence when dealing with an angry person. If they're throwing their walker or the cane at you, you also have to bar those bar. If they're in the living room, you go in the dining room. If they're in the dining room, you go in the living room. You can't leave them because that's considered abandonment. But you have to use silence and listen and try to de-escalate the situation, not to make it worse. So true, that's a true. Question number 7, guy. This is another easy question. Which member of the healthcare team counsels residents and their families and arrange for services? We talked about this in classroom with the various healthcare teams. Is it the dietitian? B. Is it the social worker? C. Is it the physical therapist? D. Is it the director of activities? So we talked about this one in class, and we stated that they are different members of the healthcare team. And the dietitian, no, she doesn't really arrange for services. She orders diets for a patient, yes? If a patient's diabetes or hypertension, she would like do a food intake and order the appropriate diet. The social worker, that's the correct answer, because a social worker normally is a healthcare team member that counsels residents and their families, and also arrange for a lot of different services and stuff. Like a lot of times they arrange for like accessory rides and stuff like that for the patient. So they are a big part of the healthcare team, and they help patient family to navigate situations. It's basically like a caseworker. So is a social worker. That will be the correct answer for that question. Guys, this is it that I have for right now. It's not a lot of questions. It's like 5, 6, 7, 8 questions. But these questions you can expect to see these questions on your upcoming exam, and even if you're taking Prometric exam, you can also expect to see some of these questions popping up. Again, if you like these types of content and these types of material, kindly subscribe to my YouTube channel, and please let me know in the comment section what other educational material you would like me to provide you with. I would also like to advise you or instruct you that continue to practice your clinical skills, all the skills as a CNA, such as a partial bed bath, nail care, foot care, perineal care, feeding a resident, turning and positioning a resident on the side, catheter care, input and output. All these are skills that you are going to need to be competent with in order to sign up for your Prometric exam. Again, thank you for tuning in, and I'll catch you in my next video. Bye for now.